Multiple sclerosis is a disease that affects not only physical function and vision, but can cause other problems like depression, anxiety, and cognitive problems with memory and other issues. Dr. Fred Foley will discuss these other issues and ways that they can be managed, as well as the problems with physical disability for best management of a patient.
Hello, my name is Dr. Fred Foley. I'm a professor of psychology at Yeshiva University in the Bronx, New York, and the director of neuropsychology and psychosocial research at the Multiple Sclerosis Center at Holy Name Medical Center in Teaneck, New Jersey. I'm here to speak to you today about psychological and emotional challenges of living with MS, challenges that are beyond the physical. Multiple sclerosis represents a series of crises in the life of a person. The first crisis is the diagnosis of MS, the symptoms leading up to it, and finally the diagnosis. A sea change in the life of a person with many questions that they ask. What does this mean for me? Am I going to become disabled? What does this mean about my future? What kinds of experiences, what kinds of symptoms am I going to have? Am I going to be disabled? So these kinds of questions represent a source of uncertainty in patients' lives. One of my patients told me that, Dr. Foley, I feel like I have the sword of Damocles hanging over my head by the thinnest of threads, and I never know when that thread is going to break. She summed it up well, the uncertainty of living with MS, since it is currently not curable, although very treatable. There still is a great deal of uncertainty and thus anxiety in the life of a person with multiple sclerosis. So MS means that one has to reinvent oneself in order to adapt and thrive over time. Just like all of us have to reinvent ourselves throughout life when a major change or a major loss occurs. We have to take stock, reorganize our priorities, determine what relationships are key and most important to us. So this process of reinvention occurs over and over again through the life of a person with MS and represents a significant psychological challenge. There is much to do once you have MS. You have to put your support team in place. You have to become a knowledgeable expert on MS so that you can understand what is happening to you and, most importantly, what you need to do to adapt and thrive with this illness. You need a team of people in order to rely on, in order to get professional expertise when you need it and as you need it. And all of this will allow you to put the MS in its proper place in life. Life is not one continuous crisis, but a diagnosis of MS is. An exacerbation of MS that presents with new symptoms is. Perhaps struggles in continuing to work at the same level or at the same job does represent a momentary crisis. So we have to find a way in the face of MS to live and enjoy life every day, and then deal with these crises episodically as they occur. There are several things psychologically that happen with MS that I want to talk to you about. The first is depression. And people ask me, how did I become interested in MS in the first place? And there were a couple of key events that happened. First, as an undergraduate at Fordham University in the Bronx, I got a job working at a multiple sclerosis center at Albert Einstein College of Medicine, which was just down the road. And at this MS center was a passionate group of professionals, neurologists, physiatrists, nurses, OTs, PTs, and every day they were striving to make the world of MS a better place for persons with it and those that love them. And I was captured by this passion. It infected me. And then a second event occurred when I started working with persons with MS. It was a patient who had MS and also had metastatic bone cancer. And she suffered from tremendous pain from the bone cancer and had to deal with her MS symptoms as well. But she was naturally an optimistic person and still managed to enjoy life every day, even in the face of these challenges and these periodic crises that would occur. And she called me one day and said, "Dr. Foley, you have to see me right away. Something terrible has happened." So I said, "Of course." She came right into the office. I saw her, and she said, This is terrible. I don't know what it is. I feel sad every day. I feel no joy in life at all anymore. The world almost looks like it's taken on a grayish tone. Nothing gives me pleasure anymore. And I just feel bleak and hopeless about everything." I looked at her and I said to her, "You have a depression. This is something called major depression." And she said to me, "This is a depression? This is the worst thing that's ever happened to me. This is by far more painful than my bone cancer. I can handle MS, I can handle cancer, but this is too much for me to handle. I need help with this." And it occurred to me at that moment that clinical depression, that major depression, is extraordinarily emotionally painful, maybe even more so than the pain one experiences from physical problems like bone cancer. And I thought about it some more, and I realized that depression is really the only illness that makes people at times, when it gets severe, want to even end their lives. When people have physical diseases, they struggle and fight to do everything they can to cope and overcome it. So I realized from learning from my patient that I, even as a psychologist, did not understand depression well enough. And at that moment I decided I'm going to dedicate my career to helping persons with MS not only understand depression, but to overcome it. And that's what I've been doing for the last 30-something years. And the good news about depression in MS is that our group and other groups have learned that it can be treated. And the bad news about depression in MS is that we know that about 50% of persons with MS will experience this severe kind of depression called major depression at some point in the course of their lives, which is greater than what is experienced by the general public. So, one of the main ways that we've discovered we can treat this quite successfully is with a type of psychotherapy called cognitive behavioral psychotherapy, which is very problem-oriented and problem-solving in nature. So what happens when you get depressed? You want to withdraw from the world. You don't want to exercise anymore. You want to kind of not see people anymore. So your behavioral repertoire shrinks. You just want to put the covers over your head and not go out. Cognitively, your thought patterns change in depression. You think negatively about yourself, other people, the future, the world, and only pessimistic thoughts can enter your brain. And we can actually see these changes in the brain of people when they get depressed on functional magnetic resonance imaging. Areas associated with pleasure in the brain, with positive memories in the brain, become quiet when you get depressed. So your thoughts are only filled with negativity. Unfortunately, those pathways don't become repressed in depression. So this approach that I've mentioned, this cognitive behavioral therapy, addresses both the physical aspects of it by encouraging you to engage in behavioral activities that are associated with a remission for depression, such as exercise and socialization, and also to change your thought patterns associated with it. So we found that this has been helpful in persons with multiple sclerosis who experience this major depression. Another challenge that you'll face, or that many face when they have MS, is a sense of alienation, a sense of being isolated. Nobody understands what I am going through. And how can somebody possibly understand what the person with MS goes through when they don't have it themselves? I'll give you an example. I was seeing a couple, and the woman had MS, and she had MS-related fatigue that was quite significant. And her husband was saying, "Well, I get fatigued too. At the end of the day, I'm tired, but I keep going and I do what we have to do and help with the kids and dinner and things like that. Why can't she?" And I was trying to find a way to convey what disease-related fatigue is like and how it's different from ordinary fatigue. And I remembered and was able to convey to the man the time I had a terrible flu. And I remember lying on the couch with my flu-induced fatigue. And I had to go visit the men's room. And I was thinking to myself, I'm so fatigued, maybe I'll just let loose here. Because the effort it would have taken for me to get up and go to the bathroom seemed monumental at the time with my illness-related fatigue. And when I was able to convey this silly kind of story to him, he got it. He understood that MS fatigue is different, qualitatively and quantitatively, from the kind of fatigue we experience in everyday life. And this helped lessen that alienation between this couple and help them bridge the gap to greater understanding so that they could move forward as a team in coping with and adapting to all the changes in their lives that MS induced. It's important not to take the MS personally. MS is like an uninvited guest that swoops into your home one day and never leaves. And every day, everyone in the household has to cope with this uninvited guest, has to deal with this uninvited guest, and has to manage their lives in spite of this interruption that is there every day. So lessening the alienation and isolation that people feel is important, and we teach couples and persons with MS how to talk about it, how to convey the meaning of their experience to others in a way that they can better understand. And we, as healthcare and mental health care professionals and organizations such as the National MS Society, provide educational materials and seminars to help disseminate this information to persons with MS so that they do not feel so isolated and alienated, and the people that they love will be able to understand better. Other issues that happen with MS, other challenges. MS frequently causes problems in intimacy and sexuality. Now, MS, they say, isn't a disease of young adults, but we know that children can get MS, and we know that older people can get MS. But it frequently kind of is diagnosed most often in the 20s and 30s, a time when your life is full of challenges, finishing your education perhaps, managing, developing a career, having children, beginning to raise a family. All of these things are interrupted and have to be managed a little differently when MS enters the picture. So I was working with couples who told me, Dr. Foley, what about our sex lives? That has changed since MS came into the picture. And I didn't intend on studying sexuality in MS, but I heard this from so many people as they were on their way out the door of the MS Center. You know, what about our sex lives? What about intimacy? That has disappeared. And so we realized in studying this problem in MS, and I'm going to tell you the single most important thing I've learned in 30+ years of research on sexuality and intimacy in MS. And this is it, the bottom line in all of our studies. If you can talk about it more with your partner, and if you can talk about it with your healthcare team, go to that office and say, I want help with this. Get educated about it. There are many MS organizations that have materials on this. In one of our studies, in a randomized trial, we found that just educating persons with MS and their partners about sexual problems and intimacy issues, that alone, and getting them and encouraging them to talk about it and share the materials and read about it, led to a significant enhancement of their relationship and their intimacy. So, like depression, the loss of sexual function can significantly impact the quality of life. But also, like depression, we have learned that there are things that can be very successfully done about this, that these challenges can be successfully addressed through education and, at times, some technical assistance from MS and healthcare professionals who can advise you on how to overcome these problems that come with multiple sclerosis. So, it's important to reach out to your healthcare team. It's important to continue communicating with each other. Another challenge that frequently occurs in MS are changes in cognitive functioning. So changes in memory, changes in attention and concentration, changes in how quickly you can think occur. Now, we've learned that these changes in cognitive functioning are not readily detectable by the person with MS. You can't tell if your cognition is changing very easily at all. So if a family member tells you that, you know, your memory is changing, or if you start getting less than your usual good reports on your work performance, you may be having some cognitive changes that are subtle that you do not know about. And it would be important for you to contact your neurologist and get something called a neuropsychological assessment. And that can outline in detail the kinds of cognitive strengths and the kinds of cognitive weaknesses you have. And with that, a rehabilitation plan can be outlined that can address these problems in MS. And we now know, and there's growing evidence, that something called cognitive rehabilitation, which is kind of like physical therapy for the mind, can help address these cognitive changes in multiple sclerosis. So, MS represents many, many challenges, to you. It represents an initial crisis that requires management. It requires that you learn to live every day with the uncertainty that MS presents to you, and learn to focus every day on the things about life that you can enjoy. So managing the anxiety, we teach patients and their loved ones something called mindfulness, meditation, and other kinds of approaches that allows you to stay in the present moment. Because remember, anxiety is always about the future. It's never about today. It's never about the present moment. And getting you to focus and train your mind to focus on today will alleviate much of your anxiety. Depression, very common. If it occurs, make sure that you bring it up to your healthcare professional and get it addressed right away. It will greatly enhance the quality of your life. If sexual problems occur, do not give up. There is ready help for these and many of the other challenges that MS represents, even cognitive changes that can occur. So in summary, I just want to say that there is a great deal of hope. There's been a great deal of knowledge that has learned that can address these psychological challenges and emotional challenges that occur with MS. Reinvent yourself. And in using your healthcare team, in using your knowledge about MS, you will become empowered to make these changes and live the quality of life that you want to live in spite of the changes that multiple sclerosis brings. Thank you.